In this session, we want to talk about pulse pressure. Pulse pressure is the difference between systolic blood pressure and diastolic blood pressure. For example, if someone has a blood pressure of 120 over 80, their pulse pressure would be 120 minus 80, which is 40 millimeters of mercury. A pulse pressure greater than 40 millimeters of mercury is called wide pulse pressure, and a pulse pressure less than 25 is called narrow pulse pressure. Now, we want to know what factors lead to an increase in pulse pressure. There are two factors or two groups of factors, anything that either raises the systolic blood pressure or lowers the diastolic blood pressure. In other words, factors that either raise the ceiling or lower the floor. What factors raise the ceiling? Any factor that increases cardiac output. For example, people with hyperthyroidism, following exercise, anemia, and similar factors, as well as vascular stiffness. Any factor that causes the vessel walls to become stiff and non-flexible can raise blood pressure. Because when the vessel walls become stiff and non-flexible, a fixed volume of blood enters this non-compliant vessel during systole. And since vascular compliance has decreased, the vessel cannot expand. In other words, reduced vascular compliance comes at the cost of increased systolic pressure, and our systolic blood pressure goes up. That's also why, in elderly people, the vessel walls are stiff and calcified. Usually, the systolic pressure is high, and most elderly people with hypertension have a wide pulse pressure. Now, what factors can lower the bottom number or decrease diastolic blood pressure? Any factor that causes our vascular or arterial system to empty of blood during diastole. One of them is aortic insufficiency. In people who have AI or aortic insufficiency during diastole, instead of the blood remaining in our arterial system and only entering the capillary system through the arterioles, it has another escape route. That means a large volume of blood flows back again into the ventricle because the aortic valve is insufficient, and this leads to a decrease in diastolic blood pressure. As a result, we have a wide pulse pressure, and similarly, any factor that creates a connection between the arterial and venous systems can have the same effect. Now, it's possible that a pathological condition has developed, such as in individuals who have PDA, patent ductus arteriosus, where there is a connection between the aortic system and the pulmonary system, and since the pressure inside the aorta is 120 over 80 and the pulmonary pressure is about 25 over 10, blood flows from the aorta into the pulmonary system. Because of this, the diastolic blood pressure decreases. Or in people for whom we have artificially and iatrogenically created a direct connection or an abnormal fistula between the high-pressure arterial system and the lower-pressure venous system, which can potentially lead to various complications. Like those who need to undergo dialysis, where we connect these two vessels and use that vein for dialysis. In these individuals as well, during diastole, blood flows from the artery into the venous system, which has lower pressure, and as a result, this leads to a sudden drop in diastolic blood pressure. And in fact, during diastole, our arterial system is emptied of blood, as if there is a leak in our arterial system. Exactly. Imagine it's like a hose that you're using to water the garden. If there's a tear in the middle of this hose and water leaks out from there, you'll see that the water pressure drops. And we see the same thing in patients who have AV fistula, AI, or PDA. This same factor leads to a decrease in our diastolic blood pressure. Now, what factors lead to a narrow pulse pressure? Any factor that lowers systolic blood pressure or raises diastolic blood pressure to some extent. Therefore, any factor that decreases cardiac output leads to low systolic blood pressure and consequently a narrow pulse pressure. Factors such as heart failure, cardiogenic shock, dehydration, decreased blood volume, blood loss, and GI bleeding are all causes that lead to reduced cardiac output. As a result, our blood pressure drops, and when blood pressure decreases, our pulse and heartbeat also become weaker and take on a thready quality. So, in general, factors that lead to increased cardiac output or, on the other hand, cause a decrease in diastolic blood pressure result in a wide pulse pressure. Conversely, factors that lead to decreased cardiac output result in a narrow pulse pressure. People with a wide pulse pressure have a bounding pulse, and their arterial pulse is felt very strongly. We can even say it's 3+. And those with a narrow pulse pressure have a very weak pulse, which may be at most 1+. Wishing you success and prosperity.